Hi everyone, I'm Jaya Vishwanathan, and you've found the No Brainer podcast where I discuss all things neuroscience in delightful conversations with various experts. I hope you enjoy today's episode.
We've talked about general health quite a bit. I'm wondering if you can talk a little bit specifically to neurodegenerative disorders, and maybe as you brought up just now, there's subjective and objective things, but then, a manifestation of that for me could be something like someone who's sad versus depressed versus someone who has a diagnosis or diagnostic criteria of, say, in a PET scan, they have a lot of amyloid. And so if you can talk just a little bit about how health economics, as it applies specifically to neurodegenerative disorders, because in my mind, one of the things that sets neurodegenerative diseases apart, not from everything, but from many diseases, is that they tend to be degenerative, and it's very poor prognosis. So once you get like an objective diagnosis, it's of, say, Parkinson's or Alzheimer's. As of now, there are no cures. There's maybe a few disease-modifying treatments that are in the pipeline, but it does seem a little bit of a fatal diagnosis, so to speak. And so how does health economics deal with that class of neurodegenerative disorders as opposed to something that has a much better prognosis?
So that's a great question. And I think that there are so many different areas of inquiry in health economics about neurodegenerative disorders. One area, of course, is the economics of care. So for folks who get this kind of diagnosis, they and their families may, depending on what kind of folks they are, they might immediately want to sort of come up with a plan of how they're going to deal with this. Other people might meet this type of diagnosis with denial, or they don't really understand it and they don't know what to do. They don't know what to expect. So individual level reactions at the economic level to a neurodegenerative diagnosis vary widely. But what we do actually know from, like if we think about microeconomics versus macroeconomics, so micro is the household level and macro is the societal level. You could think about it that way.
Okay.
And so at the micro level, what we know is that people who receive diagnoses of neurodegenerative disorders, oftentimes prior to their diagnosis, up to 3 years before, there's a fairly reliable decrease in people's credit scores prior to diagnosis. So there's something about the changes in the brain that seem to rather predictably inhibit or impair people's decision-making ability in a way that they continue to be competent financial agents for themselves. And so that's some very interesting research from my perspective, because people start to have missed payments, people's credit scores go down as a result. And so there's an idea of whether or not decreasing financial aptitude could be a marker for possible onset of dementia, including Alzheimer's or related dementia. So at the micro level, there's this issue about fraud and abuse and impaired decision-making ability. At the macro level, health economics, a lot of the work is around the cost of providing long-term care to people who have neurodegenerative disorders. So most folks, it's my understanding, and most folks who are diagnosed with Alzheimer's disease or related dementia, they might have somewhere between 3 to 7 more years of life ahead of them. And as time goes by and the disease worsens, they have an increased need for long-term care. It's interesting to note that the Medicaid program, which is for the poor, it's not an entitlement, it's a needs-based program that varies from state to state. Medicaid will pay for long-term care for those who are impoverished. However, Medicare, which covers all older Americans age 65 and up, does not pay for long-term care. Typically, they will pay for 21 days of rehab in a given year. But they don't pay for nursing home care or long-term care or assisted living, which people frequently need if they are diagnosed with a neurodegenerative disorder. Completely
Right.
aside from the payment of how we're going to pay for long-term care for folks who have Alzheimer's disease or related dementia, is the issue of the quality of care in our long-term care facilities. And so last year, I believe it was, that the National Academies for Science, Engineering, and Medicine released a report about the poor quality of care in long-term care facilities. So I think an emerging area of science for health economists is how to effectively deliver services at home. So institutionalized services are expensive. People do not want to go there because it's poor quality. However, there's this belief that we achieve economies of scale if we can get people to go to long-term care facilities. But there's no universal insurance in the United States for long-term care. So it's a very patchwork system from state to state, and people, have to exhaust their own resources before they become Medicaid eligible and can have Medicaid pay for long-term care. So, that is a very sad scenario, because for folks who have worked hard their whole life, it doesn't seem like it's right to make them become impoverished before they can get their long-term care paid for. At the same time, some long-term care facilities won't take people who have Medicaid. So not only do long-term care facilities sometimes have low quality, it could also be that they won't admit somebody who has Medicaid as their primary payer. So there are a lot of challenges in financing for long-term care.
I see. And I mean, this was so comprehensive, but I think that, I mean, there's also the family burden, right? Like, which is there's a few studies that I'm aware of, although I'm not like an expert in this area by any means, about how caregivers burn out and need care themselves. Over time, like a spouse or children or whomever, and then that imposes more negative exposome experiences for the entire family, and introduces these additional factors like housing instability. Like if you're waiting for someone to get impoverished before they get care, right? So it introduces all of these things, right?
Yeah, so thank you for flagging that. One of the things that is also studied in the economics of neurodegenerative disorders is the financial impact on family members. So you mentioned unpaid caregiving. That does have a financial toll on the family. And a lot of times in families, like what we know from time use studies or surveys of economic well-being, is that caregivers, unpaid caregivers, typically lose wages from the paid workforce. And that then has distal influences on their economic well-being in older age, because of the fact that the Social Security system is based on how much you get paid as a benefit when you're old, is based on your lifetime earnings. And so if people drop out of the workforce and don't contribute for a number of years, or if they cut back on hours and have lower wages as a result, both scenarios will, in the end, influence the amount of Social Security benefits that they're entitled to. So I actually, through my work, wrote a request for applications, which we now call notices of funding opportunity, about how to measure financial hardship among families who are living with Alzheimer's disease. Because of this fact of the unpaid caregivers having to sometimes cut their work hours or, totally exit the labor market, I'm very interested in how to appropriately measure financial hardship, both at the individual level for people who are living with a diagnosis of Alzheimer's or related dementia, as well as across their family units. So I looked, and while there's a number of psychometrically validated screeners for financial strain or stress, they weren't specific to people who are living with a neurodegenerative condition. So I'm optimistic that grants that will be funded soon will start to take on this problem and develop more appropriate screeners so that we can identify financial hardship and intervene.
That's so exciting. So thank you for that work. I'm glad there are people like you who are looking into big problems like these. So for those of you who are tuning in, I am having a fabulous conversation with Dr. Priscilla Novak, who is a health economist and has just taught me so many things that I hadn't really thought about. To look at neurodegeneration from a health economy, like from an economist perspective. So are there any other projects that you're working on currently that you're very excited about that you'd like to share with the audience?
I feel like there's always so many things.
Yeah.
Right now, I'm mainly working on, I would say like my new big thing is working on mentoring others. Recently, our division has hired
Okay.
some new program officials. And so they're brand new to government and brand new to our division. And for me, it's sort of a new role to be a mentor to somebody. I
Okay.
have 15 years of experience in the government, but only recently would I be taking on a supervisory role. Except for when I was in Peace Corps, I was a Peace Corps volunteer in Bolivia, and I was a supervisor for a year
Right.
there, but that was very different.
I have no doubt that you're going to be an amazing mentor because every conversation I've had with you, and I hope to have with you in the future, I come away from it having learned so much and just having an appreciation of the bigger picture in a way that I've never thought about the world. So that's a great project. So speaking of mentoring, what advice would you give to people of any age who might be interested in careers such as yours? And then, kind of related to that, maybe highlight to our audience a little bit the difference between working in academia versus in the service space, because you're currently completely in the service space in the government. And so, what are some of the maybe pros and cons that or not even pros and cons, but like some of what do people need to train for to prepare for a career in one versus the other?
It's a great question. I think you started off asking about sort of general advice, and my general advice would be to
Yes.
believe in the power of your dreams. There are so many people at all levels, whether it's academia or government, society at large, regardless of who we are. I think most people, young people, get negative messages about themselves on some level. You're too tall, you're too short, you're too smart, you're too dumb, you're too this, you're too that. And, if we think about being more or less than some sort of average, I think is pretty irrelevant. Each individual contains the universe inside of themselves. And so whatever dream it is that a person has, I would say be willing to work hard towards that dream and don't let anybody put you down because of your gender, because of your color, because of your sexual orientation. If you are willing to commit to a path and feel called to a path, I'd encourage that person to walk in that path that they feel called to. I think that given that sort of perspective, if health economics is somebody's calling, I would say, it's health economics is sort of a more specialized field that I think it's mainly just at the graduate level that you specialize to that extent. So a lot of times people might be undergraduate economics majors, and that's certainly a good place to start. Once people have completed their education, thinking about the difference between government and academia, I guess how I would see the difference really is I think they both involve a service to society, but with academia, I think that there's possibly less camaraderie. If people want to be tenure track professors, I think my understanding is the expectation is that each individual in an academic department brings a certain specific expertise to that department, and they're
Yep.
expected to bring in funding around that area of science. So I would
Right.
say that it's my understanding that academia can be quite competitive if you're at a research institution. There's also teaching institutions. If you're at a teaching institution where the main expectation is that you're going to teach, I hope you love teaching. And you're, in all likelihood, if that's where you are appointed, you probably wouldn't have very much time left to pursue independent research. It's not that it's impossible, but our system of universities in the US is set up that there's sort of like a tiers, and some tiers are more dedicated to teaching, and other tiers are dedicated to research. And in those research institutions, the expectation is that professors will bring money to the university through grant-funded projects. In government, I think that, government, the federal government, state government, and local government are all different places where scientists work, and in a variety of capacities. I think for federal government, we're very lucky in the United States to have what's considered a merit-based system, and to have career protections for employees who are employed as like staff scientists. So I do think that that's great. When I was at the Office of Personnel Management, my official title there was management analyst, but in that role, I interacted with the World Bank and their work group on professionalization of government workers. And so the World Bank had an initiative around how government workers get their jobs across the world, and thinking about how some countries have a very merit-based system. Some countries have like a very, what they call like a political system, where it's all about all the government workers are appointed because of their political connection. So I think in the US, we're fortunate to have this sort of merit-based system. It is very bureaucratic how people get into the system in the first place. However, I think if somebody is interested in getting into government, the Office of Personnel Management, their website is opm.gov, and they have free webinars on opm.gov that explain to folks how to apply. There's webinars that explain how to prepare your CV for government work, and also all sorts of information about pay and benefits for federal government workforce.
That's fabulous. Thank you so much for sharing those resources. I wasn't aware of opm.gov, and I'll be sure to add that in the show notes as well. So what are some of your future projects that we might be looking forward to? And I know your tagline also says author, so can you also talk about your book or books? Because I'm very excited about it, and I would like the audience to have a chance to get excited about it as well.
Thank you for that. I feel 100% comfortable saying author because I've written so many scientific publications. I am an author of many of them. However, since the COVID-19 pandemic, I have become an uncloseted author of fiction. I think that so much of what happens in human lives is defined by the story we make up about ourselves and the story that we tell to each other. And storytelling arguably has this critical role in society. And fiction is such a can be a wonderful force for good because it allows us to create worlds that we had not previously created, and to think maybe a little more objectively about the fact that we are creating our reality through what we do and don't do, and what we think and don't think. So during the pandemic, I wrote a book called Huntington Nights. That was the first book that I wrote. I have not had it published yet, but I also have recently written a second novel called Breathless in Bolivia. Also,
Mm.
I'm working on revising at this time, and once I get to revision number 4, I feel like I'll be ready to publish it commercially as women's fiction.
Okay, that's wonderful. Well, you should definitely let us know. So I'll keep the show notes updated. So whenever your book comes out, people will have a chance to read it and grow their life experiences a bit. I could not agree with you more about the power of storytelling. And I also, before we like wrap up and conclude our session, this is one of the reasons I love talking to you, because our conversation keeps like spurring off multiple lines of inquiry, philosophical inquiry almost. But what you said about the story that we tell ourselves about who we are, and how that changes over time, that's been a very fascinating kind of a journey for myself. And I think, you know, so much of what, because like, you tell yourself, oh, I'm from India, I grew up here, and this is the culture, and then you start moving around, and then it's not so fixed anymore, right? And then it becomes a question about what am I holding on to that's actually based on what I believe in or the way I live my life, versus the story that we tell ourselves about who we think we ought to be. And I think that's a very fascinating kind of journey. So, if you don't mind, how did you end up getting interested in this topic and writing about it?
I think so many of the things that I've come to or done over my life really sort of were present even when I was a child. I remember like when I was young, I was like, oh, I want to be a doctor, or I want to be a nurse, or I want to write books. And I feel like a lot of people's reaction to having so many interests was to be like, well, you can't possibly do all these things. And it's just, they're like, oh,
Mm,
you're going to have to focus. You're all over the place. We don't know. I actually had a professor tell me that one time. But I actually discount that view of the world. I think having many different
hmm,
interests is the result of being intellectually curious, and I don't think there's anything wrong with that. I think that there are a limited number of things that we can focus on at any one point in time. Just as humans, our bandwidth
right.
is limited, and we need to sleep, and sleep is essential for our brain health, and we have to do that.
Yeah.
Um, but I don't think that the dichotomy that's created between art and science really holds up to intellectual scrutiny. And I think that
Mm,
uh, being able to write a novel or a dissertation, they are not completely foreign skills, the one to the other. Both involve like focusing on something for a long time and the
mm,
intellectual humility to go back and revise. And so
right.
I think that trying to divide art and science into two separate paths and think that people need to pick one or the other just does not resonate with me, and I don't encourage that view of the world. If anything, I think that some of the things that you've done with your art of cells, I find that so exciting and fascinating. And
Thank
I
you.
think that it actually deepens people's perspective, whether it's on their art or their science, to be able to have like this dualistic existence, right? Because we're not separate
Yeah.
people. The artist and the scientist are not two different people. They are in fact one human being. And
Yeah.
the type of art that you're able to create is related to your scientific understanding. So I guess I would just say to folks who
Yeah.
have multiple interests, don't hold back.
Right. Fabulous. And I could not agree more. And like, so this other dichotomy is this also like instinctual brain, the gut brain axis kind of more primitive emotions and thoughts and behaviors, and then reconciling those with our maybe higher cognitive ability. And I agree with you completely. Like, we are one whole person with many facets and aspects to us, and we shouldn't feel beholden to put ourselves in one kind of category or box. And I think I completely agree with you. I think it diminishes the life experience as we go through, as you said in the very beginning of this session, about how, what do you do with this one beautiful life that you have. I'm paraphrasing a little bit, but I really liked that you said that. So do you have any final thoughts that you'd like to leave our audience with?
I guess I would say stay curious.
Wonderful. Well, thank you so much, Dr. Novak. It's been a real pleasure chatting with you. I certainly learned a lot, and I hope it was an enjoyable conversation for all of you and for you as well. And look forward to chatting with you around the
Thank
office soon.
you.
Hey everyone, hope you enjoyed this episode of the No Brainer podcast and see you at the next one.